forging consensus in this particular respect. If you want to forge consensus, and you want to work with people across the aisle, January 1st, 2006, you begin the process of bringing people in and making it an open process so everybody in the state understands what's going on.
2007?
No, I'm talking about what happened this past year. But that's not what happened. 3 days before the end of the session, Senator Saland and Senator Bonasek brought this bill to the floor and surprised everyone. Nobody on the other side of the aisle even knew it was coming. And that is not the way you build consensus. That is not the way you reach across the aisle.
Let's talk about health issues and health care here. Do you believe a single-payer plan is the best way to go, a universal health type of system, Canadian system?
I think that's ultimately where we are going to go, because it's the only sensible solution that we have. Unfortunately, at this particular point on a national level, I don't think there's the political will, which gets back to what we were talking about earlier, Terrence. There's just too much money from Big Pharma and from HMOs in the national level to really get people to seriously look at a single-payer health care.
Why do you think it's good? I mean, you've heard all the criticism about it, that's a Canadian plan, and
right.
The lines are long, and that people are coming here to do things, and that businesses are getting knocked out because they have to pay so much. Address those concerns.
Well, let me tell you a personal story. When I was up in Canada with my father many years ago, and he was shaving, and he threw out his back. He actually busted a disc. And there we were in the middle of the wilds of Canada, and here he was in a tremendous amount of pain, and we took him to a local doctor, and they treated him immediately right there. There was no lines, there was no waiting, and they gave him some painkillers and gave him some medication, and it was, even for a visiting American, it was free of charge.
But now there are lines in Canada, and a lot of people that are trying to get major procedures, they can't get them, and they're not getting good health care, and they're coming to the United States. And also in Canada, they've actually opted into a semi-private type of system, and a lot of people are going for that because they can get better doctor care. Address that.
Well, here we've got administrative costs in the private healthcare sector that are just outrageous, 30–40% sometimes, which is eating up a lot of our dollars. And I think when people realize that the way to go with a single payer that will reduce a lot of those administrative costs. Now, I'm not saying it's a single provider or even a single payer. What I'm talking about is universal health care at this particular point.
And
there are other things that we can do in terms of health care. First of all, we can allow the state of New York to negotiate with drug companies to reduce prescription drug prices. And that is something that the Republican Senate majority has refused to allow us to do. Another thing we can do is allow small businesses to pool their resources so they can buy health insurance for their particular employees. And another thing we can do is pass fair share for health care, which will take 450,000 uninsured people off the rolls and make their first option of health care not the emergency room but a doctor's office. These are things we can do starting on January 1st when I'm elected into the state Senate and when Elliot Spitzer is elected as governor.